Hey everyone, thank you all for joining us. My name is Michaela Helwick, and I'm the Media Relations Director at the Law Enforcement Action Partnership. LEAP is a nonprofit group of police, judges, prosecutors, and other criminal justice professionals who use their expertise to amplify evidence-based public safety policies. On the panel with us today is Staff Sergeant Connor King of the Victoria Police Department in British Columbia, Canada. We also have two speakers from the US. Chief Tom Synan, who leads the Newtown Police Department in Newtown, Ohio, and Chief Paul Pazin, who leads the Denver Police Department in Colorado. As many of you know, the US has the highest overdose rate of any country in the world by far. 1 in every 4 overdose deaths globally happens in the US, 1 in every 4. This is not a coincidence. For many decades now, our drug control strategy has focused so heavily on enforcement that we've moved what is essentially a health issue into the justice system. And this has exacerbated the conditions that contribute to individual substance use disorders. Things like shame and stigma, isolation, poverty, general instability, and other barriers to accessing treatment. There are, however, police leaders in the US that are taking a forward-thinking approach and using the tools they have available, as well as community partnerships, to address drug use in a more realistic way. Meanwhile, our neighbors in Canada have also done an incredible job of paving the way toward more sensible solutions for addressing drug use, particularly with the implementation of supervised use sites, also called overdose prevention centers. We'll be talking about that as well. And so the speakers on this panel have all demonstrated their commitment to reimagining the way that police interact with people who use drugs and the issue of substance use disorder in their communities. So before we get into a discussion, I'm going to ask each of our panelists to take about 2 to 3 minutes each to introduce themselves, and then we'll get into a discussion, and then we'll have 10 minutes at the end for questions. So Chief Synan, can you start us off? Please introduce yourself and give us a brief overview of how your community has been impacted by substance use disorder.
Sure, thank you. Hi, everybody. My name's Tom Synan. I am the police chief for the village in Newtown. It is a small community about 11 miles east of downtown Cincinnati in Ohio. We were impacted, and I was impacted by addiction. We had seen an entire family in my community die from addiction, a mother and all 3 of her sons. The mother from prescription pills and alcohol. She had 3 boys. The youngest was shot and killed by crack cocaine. The oldest overdosed on heroin and fentanyl. And then the last of the brothers overdosed on heroin and fentanyl back in about 2014. Each one of those boys had kids. The oldest had 5. We have 3 of the 5 that struggle with substance use disorder. So we are dealing with our 3rd generation of addiction in this very small community. It's what led me to help form the Hamilton County Addiction Response Coalition, which is really a community effort changing the way we view and deal with addiction as a chronic mental medical health condition. Thank you.
Thanks, Chief Synan. Chief Pazin?
Thanks, Michaela. My name is Paul Pazin. I have the great pleasure of being the police chief here in Denver, Colorado. I want to just focus on the topic at hand. We are a lead city law enforcement assisted diversion. We believe in this approach of getting people that are addicted to substance misuse disorder, the assistance that they need, and try to keep them out of the criminal justice system. We've had some good progress with it. We've also had setbacks with it, particularly with 2020 and the rise of anxiety, stress, fear that are actually driving increased numbers of overdose deaths. We also, what I'm most proud of is our public health view of public safety. We have a social correlates, often referred to as social determinants, but I know many community members don't like the word determinants. So we utilize public health data, overlay that with much of our crime data in order to try to connect people to the resources and avoid many of these co-occurring and underlying issues that manifest themselves in overdose deaths, in substance misuse disorder, and in some areas crime as well. And then lastly, I'm very proud of our team's efforts more on the alternative response, that many of these calls for service can be addressed, low-level calls for service involving folks with mental health or substance abuse challenges without police response at all. And we have a very robust co-responder program for individuals that may be armed or demonstrating violent behavior. And then our STAR program, which is about 9 months old now, where there's no police officer involved whatsoever. So, and then all of that is followed up upon with our case managers, so we can, again, try to navigate outside the criminal justice system and focus more on the types of outcomes that get people the help that they need.
Thanks, Chief Payson. Staff Sergeant King, your turn.
Well, thanks very much, Michaela. From my perspective, I've been a police officer for about 25 years, and almost all of it has been in some form or other in the world of drug enforcement or drug policy, and more lately in harm reduction. Before I get into some of the solutions that we are looking at with respect to drug overdose deaths, I'm just going to paint a picture of where we're at and how we got here. British Columbia is a province of about 4.5 million people. And through the 1990s up until about 2012, we had about 250 drug overdose deaths per year and fairly typical drug use. In 2012, everything changed very significantly for us. And that was the year that we first detected illicit fentanyl sourced in the People's Republic of China on the streets of Victoria, Vancouver, Surrey, major cities in Western Canada. And that marked a significant and terrible change in the drug situation for us. What we realized was that organized crime groups were trafficking fentanyl into Vancouver and distributing across the province. And what we found was that individual lone actors were able to import fentanyl just by way of online platforms into the province. So overdose deaths dramatically rose through the course of 2015 and 2016, at which point the province declared a provincial state of emergency because of overdose deaths. And through 2018, we saw a 600% increase in drug overdose deaths. So again, in 2010, we had about 250 deaths per year. And by 2018, we had 1,570 drug overdose deaths. So a significant increase. Our goal initially had been enforcement on all fronts, but we saw really limited success, and I'll get into that a little bit later on. But now drug overdose death is the leading cause of unnatural death in the province of British Columbia. And I can say to a certainty that almost everybody I know knows somebody who has died from a drug overdose. So we really consider it a significant crisis situation. And I'll stop there.
Thank you all. We can go in any order you choose, whoever feels moved to speak. But my first question is, and some of you have answered this to some extent, but if you can take this time to dive into that a little bit more, is how your department has created a holistic model for addressing drug use. What are the different components of your strategy?
Sure, I'll kick off. Obviously, law enforcement, in my opinion, we don't have the tools, the knowledge, or the skill set necessarily to deal with a lot of the chronic medical health conditions, but obviously it falls on to our footsteps to be able to do this. But having that family and that incident with the family, we had tried everything we could think of to try to help them, whether it was enforcement or other avenues, and it didn't work. And a lot of that was because we weren't necessarily connected to the right resources. So what we thought we needed was a community response. If we took it as a holistic community approach, we felt that you would have the right people at the table that would be able to break down some of the barriers. We're not doing anything necessarily like rocket science. We didn't invent anything necessarily when it comes to a coalition. It's much of what you see across the country as far as a treatment pillar. What we call an interdiction would be police, fire, the Office of Reentry, more on that criminal justice side. And then we have harm reduction and prevention. We did a couple things different. We included the faith community and the business community. But the other thing we did was sitting at our table has to be the heads of each one of those agencies. We did that so that we could respond rapidly. And that played a role in 2016 When carfentanil first hit the United States, unfortunately, Cincinnati was one of the first areas to see carfentanil. We had nearly 200 overdoses in 1 week. Having that coalition, that community group together with the people that are the heads of each agency allowed us to respond more rapidly and efficiently. It also helped in COVID. We were able to pre-plan going into lockdowns, as well as when we were in lockdowns and coming out of lockdowns, we were able to respond more quickly because we had that community aspect to it. So the community involvement, that holistic approach has really helped us.
Michaela, I'll just jump in just because very similar approach. We're just ending up coming at it from different approaches itself. So we, in our area, the only way that this is successful is with not only the whole of government approach, but our nonprofits, our faith-based leaders, our other community-based organizations that have helped us. We've had some tremendous partners with the Harm Action Reduction Center, some tremendous partners with the faith-based groups in our city that have helped us to utilize this social correlates model in a particular neighborhood that has faced historical challenges. It has been marginalized and disenfranchised for many reasons, or not many reasons, but for many years. And by utilizing this collaborative approach is how we're able to affect better outcomes, and many of which have opened up our eyes to new ideas and new approaches to take this public health view instead of the traditional law enforcement approach that I think we know putting somebody that's addicted to a substance in jail isn't going to cure an individual of a health issue.
Staff Sergeant King, would you like to go?
Yes, sure. Thanks, Michaela, again. In Canada, we have the benefit of a national strategy when it comes to dealing with the drug overdose situation and drug use in general. And the strategy has 4 pillars: enforcement, prevention, treatment, and harm reduction as part of our national strategy. And that's very helpful. Harm reduction to us really just means recognizing that there are harms associated with drug use, but there are mitigation strategies that can be used to tackle those harms. And also harm reduction recognizes that asking people to stop using drugs is not necessarily the right answer for that individual person. So with harm reduction being an important pillar, provides some guidance for police. And what's really important to recognize that in Canada, we have done a pretty good job, particularly in Western Canada, of recognizing that drug overdose deaths is a wholly public health emergency and much less of a criminal phenomenon. Because of that, police agencies, including my police department, looked for opportunities to join with health providers in some way that we could do our part to help out. And what we did in 2015 was join with the British Columbia Centre for Disease Control. The BC CDC is really the lead agency in tackling drug overdose deaths in the province. And they have a working group called the Drug Overdose Alert Partnership, which is really a fantastic consortium of key stakeholders. So the largest police departments in the province, the coroner service, Indigenous health authorities, public health authorities, toxicology lab, and Health Canada all have a voice at the table at the BC CDC working group. So that's an opportunity for us to share real-time information about things like drug toxicity, as well as examine overdose clusters and make real efforts to try to reduce overdose deaths. But where it became incredibly important was in 2016, the provincial government of British Columbia enacted emergency measures to bring in overdose prevention sites. And they handed the BC CDC the job of rolling out the OPS sites, overdose prevention sites, into the province. With the police at the table, we were able to play an active role in creating the guidelines for how these sites would actually work in communities and how they would cooperate with police efforts. And of course, what needs to be really understood is that OPS sites are tricky for most societies to wrap their collective minds around, because drug use inside an OPS is legal. It is legal in Canada, but drug possession outside the site is still illegal. It is technically illegal in Canada. And so great care is needed in trying to massage a situation where these sites can work. With police at the table, we set ourselves up, I think, for the best case scenario. So I just offer that as one example of how my police department and others here have been working with health to actually enact real harm reduction efforts. I'll stop there.
Thank you. And my next question is, what are some logistical and political roadblocks that you've experienced along the way when sort of instituting, whoop, sorry about that. What are some logistical and political roadblocks that you've experienced? If you've been successful in overcoming those obstacles, how did you do it? And what can other police leaders learn from your experiences? Let's start with Chief Synan.
I was going to say one of the biggest roadblocks is obviously drug use is illegal in the United States, and that ends up being a huge roadblock, especially when you're trying to do stuff like harm reduction or trying to find new initiatives or diversion programs. Another roadblock is, especially here when you're talking about a community coalition, a lot of this is law enforcement led, and we're trying to build almost like a healthcare continuum care model out of the criminal justice system, which is inherently difficult because you're taking pieces of criminal justice and healthcare, trying to mesh them together. And that doesn't always go together. And it definitely does not make for a fluid or efficient and necessarily an efficient system. If this was in the healthcare system, maybe it'd be different having one system that'd be able to prong out, but that ends up being one of the challenges. And when you're building a community coalition like this, one of the things I didn't anticipate was some of the roadblocks other entities would have. Treatment with CFR 42s, the healthcare system with HIPAA regulations. There's rules and laws that apply to each different agency. Even in law enforcement, there's certain things we can and can't do. So that ends up being a struggle. But what helps is having that group together, having those people sitting at the table, you can become advocates for each other. And although you may not be able to break down all the walls, and I hear a lot of people say, well, we got to break down silos. I disagree with breaking down the silos. What I think is that people should stay in their silo, but there should be a front and back door that we all can walk in and walk out of, because we need each other and we need that expertise. I'm not the health expert, but our public health people are, and working with law enforcement and them together, along with treatment and the other prongs of the coalition, allows us to advocate and change some of the rules. If we can't change the rules, can we make the system a little bit more effective and efficient? But it is a challenge, especially in the United States, if it's not viewed as a medical or mental health or a chronic condition. If it's still a crime, there's that challenge. But having that coalition and those people working together does allow for some of those barriers to at least be bent a little bit so that you can work around them. But my advice would be stay persistent. That has been the key to this, is stay persistent, have an open mind, hear from different parts of the community. And usually when I talk to somebody, I validate everything they say except for that we should allow people to die. That's the only thing I will not validate. If you're going to say drug use is a crime, there's validity in that. If you want to say harm reduction helps, there's validity in that. But if we come to the table like that, we'll be able to find more solutions and more ways to work around some of those hurdles. Thanks.
Chief Faison
Michaela,
or yep.
yeah, I'll just jump in, and I'm taking Tom anywhere I go. I think he articulated this very well. The only little piggyback that I'll add to the conversation is we in law enforcement also have to recognize where we are in this moment of time with regards for calls for change, reimagining policing, demands that our community has placed on us. And although we had some very strong relationships and collaborations with community-based organizations prior to what we saw last May, there's been a little bit of a stepping back. Trust has been eroded even with partners that we have worked very closely with. We have to set aside those differences and still come together to figure out these solutions, because as Tom discussed, and what I can share from what we're seeing here in Denver is people are dying. We have more people that are overdosing and losing their life to substance abuse disorder. And we can do both. We can address the calls for social justice and demands for change, but we have to work together and solve this very complex issue, or work to solve this very complex issue for the sake of our communities.
I can start off here if you'd like, Michaela. So it's fantastic dialogue there, and hard to follow, but I'm going to stay focused on the overdose prevention side piece of this, because I think it's a unique perspective that Canada can share. And so when the question is posed about what are the logistical and political roadblocks, I want to call out a roadblock to overdose prevention sites that we have seen time and time again, which is this significant concern that police have to tackle about maintaining public safety when you introduce an overdose prevention site into a community. The real concern that we have faced over and over again is people's and police departments and community members' concerns about neighborhood degradation and what negative impact a site might bring. And so this has been a place that we have done an awful lot of front-end loading work to tackle this significant issue. And really, I'm going to say a word here that is just so simple, everybody's going to get it, but it all comes down to communication. What we did here in Victoria is we actually followed the CDC guidelines on overdose prevention site rollout, which requires of us and requires of the OPS sites to have police at the table for planning and implementation of sites. And I call it three things. I call it early, meaningful, and sustained communication with the service providers that are going to put one of these sites in your community. So by way of a tangible example that some people may have heard of, is that here in Victoria, we have a site that is it was brought about after the arrival of COVID-19. So last March, we had a lot of disruption to our marginalized community. And so the province created a homeless shelter in the hockey arena, of course, of all things, next to the police department. And inside the hockey arena, on the inside, we have an overdose prevention site that is for people who are injecting drugs. And outside the site, we have OPS for people who are inhaling drugs. And we needed that because 60% of all drug users in BC who use opioids do so by inhalation or by smoking. So we share a parking lot with this site, and it was in our interest to make it work and to get it right. We assigned a sergeant from our community services division, and he joined a team with the hockey arena manager as well as with the service provider of the site. And we have come to refer to them as the three amigos, because these guys were the right people for the job. They get along really well, and they made this site work because they addressed problem after a problem. Anytime something arose, they were on it and they got it resolved. Conversely, we have had sites where there has been significant issues with respect to things like refuse or garbage outside, some drug dealing in the neighborhood. And where we struggled to get traction was because we did not have that early, meaningful, and sustained communication. We had to reset the course and correct that communication. And once we did, we resolved the problem on a case-by-case basis. So I would just, recommend to police leaders that are thinking about whether they can or can't support something like an overdose prevention site. I would just offer this, that the approach we took was basically that it is an us and us situation rather than an us versus them situation, and that the communication component just cannot be overstated. And I'll stop there for now.
Thank you. And my last question or set of questions is what would you say to police who are hesitant to take a new approach to addressing drug use? And how can police overcome a mindset that drug use is a moral failing and bring a growth and prevention and collaborative mindset into their work with people who are using drugs and the advocates who work on their behalf?
I guess I'll keep the order going here. I think Paul said it really well. This is a complex issue, and I struggle with a lot of this. And I think that's my advice to law enforcement, is that it's okay to struggle with this. I got some really good advice from someone, and they said, look, you're a strong advocate for those that may be struggling with substance use disorder, but I grew up in a family where my parents were a dealer. And this was someone who's in the criminal justice system, and said, I struggled with that, and my family struggled with it, and I loved them, but I struggled with it. What do you think about that? And I said, well, I would struggle with that too. And he stopped me and said, that's all I want you to do. Because if you're struggling, that means at least you're keeping an open mind. Well, at least keep an open mind. And I think that's my advice to those in law enforcement. Look, this is not easy to be in law enforcement, this traditional law enforcement, where you still have part of the profession that's saying, look, this is a crime, we need to arrest people. And then there's others saying, well, we've tried an approach, let's try something different. So I don't think there's anything wrong with law enforcement officers struggling with this, or police leaders struggling. It is very complex. It's not easy. If it was easy, we would have all figured this out. But with that, I will say this is, I often go back to, why did we get into this job? And that was to help people. And how many other issues do we deal with that we kind of take a different path to, and we're trying to actually resolve the issue, not just punish somebody or to put a Band-Aid on it or to temporarily fix it. I think what you're seeing from this panel, what Leap's doing and what other police leaders are saying, look, we've tried that way. It doesn't seem to have worked. Yes, there's some validity to it. There may be some avenues, but we've got to try something different. Let's at least be open enough to try something different. Let's at least struggle with this enough that we are willing to listen to others, have an open heart and open mind, and let's see if it works. I mean, even here in the United States, when we're talking about supervised sites, yeah, I struggle with that. I mean, traditionally as a law enforcement officer, my first reaction is, how can we do that? But if I struggle with the issue, then I can start seeing that maybe there is an avenue here. Maybe this is a tool that we can add to this. And that's my other advice to law enforcement. Don't be looking for the one particular key, because there isn't one. What you got to do is look for all these tools and bring them together. And again, going back to that holistic approach of having a coalition together, I think that is our superpower, is that there's so many people with different views that allows for each one of those pieces of the tool, or each one of those tools, to be part of that puzzle and be a piece of that puzzle that you can connect. Maybe it doesn't connect all the way. Maybe it's not 100% connected, but it brings you that approach that you can start building that continuum care model. But it takes all the pieces. It takes everyone struggling, and it takes everyone to open up a little bit. And then I think you'd start making some changes. So as a law enforcement officer, man, my advice is, it sounds simple and it's two big things. Be persistent and go ahead and struggle with it. It's okay.
Chief Payson?
I cannot add to that. I think both Connor and Tom have articulated this very well. Yeah, it's really just being open-minded, and I'll just leave it at that. Thank you so much.
Thank you.
Michaela, I'll add some commentary here from the sort of the Canadian perspective, but I certainly agree with Chief Sinan's comments about there is no one key, there's no one solution to this situation. But from our perspective, what I would say that we have the benefit of doing here is that, well, really, when under the sheer weight of drug overdose deaths, there was kind of a collective tipping point reached by police leadership in British Columbia, where there was a recognition that what we were doing really wasn't working, and that to continue to do the same thing over and over again was just not a logical approach to the situation. So, and again, one thing that we did here that I'm pretty proud of is that we adopted this approach where we said we would not say we will never try something, we will never do this, we will never do that. We would at least examine or listen to all points of view and all perspectives on alternate solutions to a problem. Before we would rule anything out, we would listen to the merits of any particular solution. So when it comes to the nuts and bolts of what we faced here in Canada, there's a couple of key things that we had to look at. With the advent of the arrival of fentanyl and carfentanil, as Chief Sinan has experienced as well, we saw something really strange happen in Canada. We're typically known as a country that has a very, or at least somewhat by comparison to other nations, lenient sentencing guidelines. But in Canada, through 2015 to 2020, there started to be some very, very significant sentences handed out to fentanyl importers. We saw sentences ranging from 15 to 20 years for fentanyl importation at the high level. At the street level, here in Victoria, we saw an individual sentenced to 3 years in prison for being in possession of about 2.5 grams of fentanyl. So that's just the weight of a couple of coins. The idea being that these harsh sentences were going to deter fentanyl traffickers. Frankly, stop overdose deaths, I would take almost anything, but it did not have any real benefit to us whatsoever. And in fact, we're in a situation now where fentanyl is the opioid of choice amongst opioid dealers. And so it has fully saturated our local drug market. The other thing that we had to come to grips with was that we really wanted to see fentanyl importation stop. We wanted to see the stop of fentanyl on our streets. We worked very closely with our partners at Canada Border Service Agency and with the U.S. authorities, Department of Homeland Security. And my department was involved in investigations that had us looking at factories in China to try to stop fentanyl's flow into Canada. Nothing worked. Nothing worked. Just like, sadly, nothing has worked to stop heroin, meth, or cocaine from infiltrating our communities. And so with that, we really had to say, okay, it is incumbent upon police leaders to look at what we can do to stop overdose deaths. And it is with that kind of open-mindedness and open-heartedness that Chief Sinan has mentioned that we said, okay, until we can figure out other ways of tackling drug overdose deaths, let's work on keeping people alive. And that is where we got involved in harm reduction measures. Let's keep them alive because somebody who dies from a drug overdose is never going to recover from drug addiction. So if we can keep them alive until they reach a place in their lives when they can stop using drugs or use drugs safely, if that's the path they're on, then that's what police leadership needs to do. So basically, it was to take a far more holistic approach to the wellness of the community rather than strictly that one enforcement approach. So there's more to it than that, but I'll leave it there for now in the interest of leaving some time for questions. Thanks.
Thank you. All this was so wonderful. We are going to open things up for questions now. Jennifer, I think you are assisting, correct?
Yeah, so I'm monitoring any raised hands. So if we see any, I can ask the attendees to unmute themselves. I don't have any raised hands at the moment, but I encourage people to enter questions in the chat if they'd prefer to do that or into the Q&A. Carl has a question. So Carl? You can unmute yourself, Carl.
Can you hear me now?
Yes.
Okay. My question is in keeping in line with the thought of how do we change officers' approach, the moral dilemma, the thoughts that they give to, approaching the drug dilemma as a health crisis. How are you respectively as police leaders and other police leaders introducing that approach to training, to basically to the recruits, the people that we're hiring, that basically this is kind of, we'd all like to think that we're approaching the new normal of how we approach drug enforcement / prevention / rehabilitation. Is there some process of incorporating that into training and hiring of the younger recruits who are more, impressionable and malleable, taking it forward?
Carl,
Can
I'll
take a swing at that. Go ahead.
Carl, jump in on that if you don't mind. I was actually out at our academy Friday speaking to our officers and sharing with them updates of where we find ourselves, where we're headed, and very specifically pointing out our public health view of public safety, talking about the very comprehensive approach that we have with mental health professionals that ride with police officers in our co-responder program, explaining the STAR program where you have a mental health professional and a paramedic to handle the low-level calls, and then explaining the importance of our case managers or our outreach case coordinators to help on the follow-up. And I know that the focus here is on substance misuse disorder, but these things are intertwined with mental health. We see a lot of co-occurring challenges, or the substance abuse masks the mental health challenges. And so we need to look at these holistically. So a couple of things. One, making sure and even asking them their understanding of our approach. These young officers actually get it. They get it much better than older folks like myself out there. It took me a while for the light bulb to click on. They see it right off the bat. They see the value of it right off the bat. And then that's continuing to be reinforced out on the street. This, again, I don't want to hijack the conversation, but our STAR van, our alternative response, every district that I go to, every roll call that I go to, it is the line officers and the frontline supervisors that are, hey, when can we get more of that? How can we, find more funding or support for the STAR program, the co-responders, and then what I see is the glue for our city is the case management afterwards. So that way, beyond just that initial call where you're helping somebody with substance misuse disorder or helping somebody with co-occurring issues, is that you do that follow-up piece. Beyond the call today, what about next week, next month, next year, and how do you create those long-term sustainable paths? So, Carl, thank you for your question.
Okay, we encourage others to write any comments in the chat or raise their hand.
Michaela, I can just add to the answer with respect to Carl's question about how to reach those police recruits, etc. I actually have the good fortune of teaching at the police academy, and I've been teaching a drug identification class for the better part of a decade. But over the last couple of years, part of that class has naturally morphed into a conversation about addiction and the science of addiction, and some basics about the drug-seeking behavior and the role of dopamine and serotonin, and the nerdy science guy surfaces quite quickly in this classroom, and we talk about addiction, and the conversation has really morphed into making sure that they understand that addiction has absolutely nothing to do with the quality of someone's character, and that's something I think that the police academy recruits that I've met, some really get it, and some are really surprised to hear me say it, because they have this vision potentially as they enter the career of policing. I don't know if it's born out of watching too many Miami Vice episodes, or if that's just my era. But in any event, they think that they're going to be chasing bad guys who are, and maybe some of them are high-end organized crime guys, are bad guys. But many of the people we deal with on the street who are drug addicted, I don't think of them as bad guys. Only if they do bad things, and then we're all about trying to get them some help and get them on a right path. So Carl raises an excellent point, and it is incumbent upon us to get this message to our police recruits, because it's new. In many ways, it's a new philosophy in police training that this kind of message needs to be part of the basic core policing. This link, like Chief Payson says, to the concept of mental illness and drug addiction, or the treatment of trauma through self-administering drugs. That's really important for our young police officers to understand, and they'll be far better equipped to deal with people on the street than, say, I was nearly 25 years ago, where we just didn't have this good understanding at the street level. And I hate to think of all the terrible mistakes we made when we dealt with people, and now we're, I think, in a much better place. So I'll just leave it there for now.
Thank you. I got a question typed in through the Q&A from Kristen. She says, my small department, 48 sworn officers top to bottom, has a command staff that is in agreement with addressing drug use and mental health issues as a health problem and not a crime to an extent. We have a crisis intervention team, which is essentially a coalition doing follow-up phone calls and letters. But now what? We can't make people with substance use disorder get help, nor can we force any mental health help on anyone. It's frustrating that we have gotten to this point. I'm sort of paraphrasing here. It's frustrating that we've gotten to this point and agree that these people who are suffering need help and support, and not an introduction to the justice system. So what can we do? And something that just immediately comes to mind for me, and you guys can build off of this, is that people who use drugs and people who have mental health conditions aren't going to suddenly start trusting police overnight. They've experienced criminalization and stigma, and many people with these conditions have been severely harmed by their interactions with police, largely because of the structures that we have that are, we're sending the wrong person to the job. So I was hoping that each of you could sort of build off of that.
Yeah, I was going to follow up on that. And Kristen, that is one of the hurdles that we face. And that's why I keep using the word chronic. But something with this too is, I think we as a system are partly the blame, not intentionally. I hear a lot of, we got to meet people where they are, and I agree with that, but we can't leave them where they are either. And part of this is, when we refer people, we're either giving them a card or making an appointment for them. There's really not that human follow-up, and it also depends on resources. So one of the things, like, you have a crisis intervention team, we have a quick response team, which is a police officer, firefighter, and addiction specialist. The police officer kind of takes a back seat, really. It's just more the organizational part of it. But we've kind of revamped that. And where it was reactive, it was post-overdose. We're now changing what we're going to do with that and make it more proactive. And what we've done is we've signed agreements with many treatment providers, our biggest hospital. We have an engagement center that's funded by the county, where people can go in and get detox, and then they get a card and referred to treatment. And often it stops there, or there's a phone call made. What we're doing is we're taking the quick response team, and we're actually going to go out and make human to human contact. Now, will they go right away? No. Can we force them? Absolutely not. But that's not the key to this. I get some of the best advice from people in recovery. And someone who was in recovery talked about an important person to them that came every day and built a relationship with them. Every day they stopped by to see him and said, how are you doing? They didn't say, let's go to treatment, let's do this. They just built this relationship. And they saw that person and they said, I want to be like that. I want to be able to get out of this and be able to have a job in a house and the family back like they are. Basically, it was a role model. So what we're doing is we're changing this. We can't change the system as a whole, but what we can do is take human beings and follow up with those referrals and be that relationship builder. So what our quick response team, and we're actually have navigators will do the same thing, is we will follow up human to human, not just a letter, not just a phone call. If you have the resources, it's one option, being able to go out there, build that relationship. And when someone's ready to go into treatment or get help, and it's not even treatment. A lot of times it may be, how do I get food? How do I get housing? How do I get clothing? How do I get mental health care? How do I even go for an open sore and get treatment, medical treatment? So those people actually be out there in the street building a relationship. And when someone needs help and are ready to go, they will literally drive them there. Now that's one part of it. You have to continue to follow up with that person and make that system easier to maneuver through, because the system as a whole, because it's not healthcare, remember, we're doing public health, criminal justice, we're putting all these pieces together. If we have someone that is available to them, a human being that can answer questions and be able to get to them to the next step, that'll help out tremendously. The other good piece of advice that person in recovery gave me was no one educated me what the next step was. I was scared when I was in treatment. No one told me what to expect, and no one told me what the next thing to expect was. So that's what that group will be doing. If you have the resources, that would help out a lot, that human to human contact. And maybe your crisis intervention, depending on how overwhelmed they are, maybe they can do that human to human follow-up. If they can't, then where else in the community can you get some resources that can help you with that? But this is my belief, and what I've changed here in the coalition is that we've got to move away from just a piece of paper or telling someone to make a phone call, and actually assist them through the system.
Connor, do you want to jump in, or I could?
No, go ahead, Chief. Go ahead, sir.
So I sympathize very much with Kristen here in this conversation. I also want to point out that we're very fortunate in our city with regards to some of the resources that we have. About 2 years ago, we were lucky enough that the people of Denver voted for a ballot initiative. It's called Caring for Denver, and it specifically sets aside about $36 million a year annually for mental health and substance abuse. And then 10% of that $36 million is directed towards the police department for co-responder, STAR, outreach types of programs, so we can take these types of approaches. Now, I recognize that that communities across our country don't have that same luxury. However, I do want to point out that with Medicare and Medicaid reimbursement, many of these programs are not as expensive. And again, I'm talking from the United States perspective. Many of these programs, for example, our co-responder program, when we initially created, even before the Caring for Denver ballot initiative, we set aside essentially $1 million in order to do this. We found out with those reimbursements that we could do it for half the costs. And I would encourage folks to look at that approach. And then also smaller jurisdictions partnering with other jurisdictions in their area to share that resource. So our STAR van, for example, in the first 6 months has handled 748 calls for service in the catchment area, but it wasn't going call to call to call every day of the week. There were some breaks in that. So if communities can pool resources together and also really navigate what those reimbursements look like, and also look at some of the savings, jail bed savings, as well as emergency stay at the local hospitals and transports. There's savings associated with that as well. And kind of taking that broader perspective may assist other folks in order to get alternative responses, as well as that follow-up piece with the case managers.
There are some additional comments in the chat, Michaela.
I'm not sure. You might be able to see something I can't.
So recently I think we may be all caught up here. I just wanted to be sure. One just came in, but that's just your panelists replying perhaps.
Okay. We do still have a few minutes left if folks have questions.
One of the things I was going to add too, if it's okay, and Connor kind of touched on this when we were talking about what force some of the changes would allow some in law enforcement to change. There's a sad reality to this too, and that is fentanyl really in our area forced us to change how we view and deal with addiction. And what's sad about that is that we didn't pick up before with other drug trends, and we also it really brought all the other issues to the surface, whether it's economics, race, disparities, all that was really bubbled to the surface. And fentanyl brought that all up and to a point that we couldn't ignore it anymore. And what I tell people is if your community hasn't experienced fentanyl yet, I will say prepare for it and build a coalition, because if you have heroin or opiates, it will transition there. But many people don't do that because they don't think it'll come to the community, it won't happen. But I will say if it gets there, you'll be so overwhelmed that you'll be forced to change. And I wish here in the United States, we would have the foresight and the vision to want to change before that and not wait for fentanyl to force us to do it. I hope what people get out of this is go back to your community and go through these hurdles, struggle with these hurdles, build those groups, build that holistic approach so that if it does happen, you'll be able to deal with it. And to Paul's point about this, when I helped develop the coalition, it was really never about drugs, because the people sitting at the table will be able to deal with any social issue that comes up that is often at the doorstep of law enforcement, which we don't have the tools. I now have all the community members that are able to help and work on any social issue. It may be addiction, mental health, economics, disparity, whatever it is, we can deal with those. And we actually changed our name from the Heroin Coalition to the Addiction Coalition because we realized homelessness, employment, transportation, housing, all that played a role in it. So please have the vision and the foresight to understand that to be ahead of this. Don't allow fentanyl to come to your community and then deal with the overdoses and the deaths, especially the immediacy that causes. Be prepared beforehand and build these groups, build those connections, and get the resources ahead of time.
That's fantastic advice. Thank you so much for that. And something that I've found helpful when speaking to people who might be resistant to these ideas is just sort of explaining the mechanics of how fentanyl came into existence. There's this perception, I think, that can be perpetuated by clickbaity media that fentanyl is this, that fentanyl was sort of created by like evil people who just wanted to kill all of their customers. But that's not, first of all, it's bad for business. It doesn't make any sense. But the reason that fentanyl exists is because it takes up less space. It's easier to smuggle. It's easier to move a potent amount that it can affect an entire market's worth of injecting opioids if you can fit what you need for the Eastern Seaboard in a single vehicle. And so this is, a bigger conversation around the laws. How are the laws pressuring but not actually controlling the underground market and then ultimately affecting the end user?
I don't see any other raised hands. This was so wonderful. Thank you so much. Just wonderful.
Thank you all so much to the audience. Thank you so much for being here with us, for making the time, for being part of this conference. It's really wonderful to see these, see people having conversations with people that they may not have had an opportunity to speak with, and getting law enforcement and public health experts talking to each other. It's so very important. And thank you so much to our panelists, Chief Tom Synan, Staff Sergeant Connor King, and Chief Paul Pazin. Please give them your thanks virtually in the chat if you can. We are all affiliated with the Law Enforcement Action Partnership. That's lawenforcementaction.org. We're a group of police, judges, prosecutors, and other criminal justice professionals who advance evidence-based public safety solutions, dealing with drug policy in a new way, harm reduction, and overdose prevention centers, and so many other solutions that fall into that category. It's just a one component of the many issues that we work on, in addition to policing and dealing with incarceration as well, which have been increasingly understood to be overlapping with public health issues as well. So those are just touches on the scope of issues that we work on. And if you'd like to learn more, check us out. And I think that's a wrap. Thanks, everyone.
Thanks, Michaela.
Thanks, Jennifer.
Bye-bye.
Thanks, Chief Synan.